I first met Andreas, I think back in April when he came in to see us after he'd suffered a concussion in soccer, I think with a collision, head-to-head collision with another player. Andreas was first seen at Nationwide Children's emergency room and then was referred to us in concussion clinic for further evaluation. Andreas was in pretty bad shape when we first met. He had a headache, he's having some neck pain, he had a broken nose, he's really having problems with bright lights and loud noises, really trouble concentrating and focusing. So concussion is an injury to the brain that typically comes from an acceleration-deceleration of the brain inside the skull. People tend to think of it as a structural injury like a bruise to the brain, but it's really much more of a functional problem. It affects the way some of the electrolytes flow in and out of the cells in the brain and the way the blood flows to your brain. With concussion, we look for typical symptoms like headaches, dizziness, sensitivity to light, sensitivity to noise, feeling just foggy, difficulty concentrating and remembering. Andreas' symptoms were very typical of what we see with concussions. Andreas, like most kids that we treat for concussion, we start with physical rest and mental rest, including we had him out of school, I think, for probably almost 3 weeks. He was unable to go back. We avoid physical activity, one, because we want to give them a chance to rest and heal. And I think that with increased heart rate, blood pressure, increased blood flow to your brain at a time that your brain's trying to heal and doesn't need that extra stress. Also, mental stimulation from school or from some of those other things that we mentioned can cause your brain to flare up and make your symptoms worse. We also ask them to avoid things like video games, computer games, doing a lot of texting or listening to MP3 players, things like that can be stimulating for your brain. I think for Andreas, the big problem was this was his third concussion, and his symptoms lasted significantly longer at this point than some of the other ones. I think it was probably the accumulation of the number of concussions he's had. We feel that the more concussions you have, the more susceptible you are, and that the symptoms tend to get worse and last longer with each concussion. And I think he just reached the point that I didn't really feel comfortable clearing him to continue with contact sports with the fear that the next one could be even worse. One of the most important things for parents and coaches to know is that kids should never return to play while they're still suffering symptoms of a concussion. When you go back to play before you've fully recovered from a concussion and suffer another blow, sometimes even a minor hit, your brain starts to swell inside your skull and it can lead to paralysis or even death. It's very common for kids to have symptoms for much longer than adults. So a lot of professional athletes will get a concussion and they'll feel better in a few days and be back to play within a week. It's not unusual at all for a kid to have a concussion and have symptoms for weeks. I think it's important that adolescents seek care at Nationwide Children's Sports Medicine because we can test them on a computer test for neuropsych testing, do a balance test, look at their neurologic exam and follow their symptoms over time to make sure that everything's fully resolved before we safely return them to play. Because we are a pediatric facility, we understand that kids' brains are not fully developed and that they're likely going to take longer to recover from a concussion than adult, so we treat them with special care. Today I think Andreas is doing great. It wasn't actually till his last visit that I truly realized how bad his concussion was because it was the first time I saw his true personality. It's great to see him smile and act like a normal kid again. We've decided for now he's not going to play soccer and that he's going to try to pick up some other sports that aren't as much into contact, but we could revisit this in the future depending on how he's doing. Even though soccer's out of the picture for him right now, he can still be an athlete.